Hello, my name is Dr. Michael Pro. I'm a member of the Wills Eye Glaucoma Service, and I'm here today to talk about narrow angles. Narrow angles are a relatively common finding, often found on routine eye examinations. The angle refers to the area between the iris and the cornea, and the angle is where the drain is located in the eye. It drains the fluid. In most individuals, the angle is open, and the fluid has easy access to this drain. But in some individuals, the angle is narrow. The space between the iris and the cornea is small, and the fluid may have difficulty draining from the eye. You may be at greater risk for having a narrow angle if you are farsighted. Farsighted people may need reading glasses sooner than others. Also, Asian individuals may be at greater risk for having a narrow angle. And finally, you may be at greater risk for having a narrow angle as you get older, because the lens inside the eye becomes thicker, and this also pushes the angle closer together. The reason why you need to get checked to see if you have a narrow angle is if you have a narrow angle, you are at greater risk for having something called an angle closure attack. And that is when the angle completely closes up. The iris and the cornea come together, and the fluid in the eye has no way to get out. The pressure in the eye can go quite high, and the eye becomes at risk for having damage to the optic nerve, and you could lose vision. It is very important to get checked for a narrow angle if you have the risk factors, which I discussed previously. It is important that you see your eye doctor regularly. If your eye doctor feels that you do have a narrow angle, the treatment is a procedure called a laser peripheral iridotomy. A laser peripheral iridotomy is performed in the office and is a quick and relatively painless procedure. A lens is placed on the eye, and a focused beam of light is used to create a hole in the iris. This allows the fluid to drain normally and prevents an angle closure attack. This is important because prevention of an angle closure attack can save your vision. Your eye doctor can discuss the risks and benefits of a laser peripheral iridotomy with you. With proper diagnosis and treatment, a simple laser procedure can save your vision.